Kids who grow up with a hereditary blood disorder called sickle cell disease don't grow out of it. And until now, adults with the disease often went to the emergency room for routine care. Thanks to Dr. Biree Andemariam, a hematologist with the UConn Health Center, they now have a place to call home. We welcome her. Thank you so much for joining us.
Thank you.
First, just explain to us, what is sickle cell disease and maybe what are some of the symptoms?
Sickle cell disease is the most common inherited red blood cell disorder. It affects about 100,000 Americans and several thousand in our state. It causes a profound anemia. People with sickle cell disease have about half the circulating blood than the average population does. It also causes a severe pain state and can compromise just about every organ system in the body.
So if you have any questions, is the good advice to go get tested maybe and see if potentially you do have that disease?
Well, interestingly, in our state, every child that is born is tested for sickle cell anemia as part of the state mandatory newborn screening. So if you are one that has sickle cell disease, you'll find out during infancy.
Now, I understand you are helping patients transition out of pediatric care into the health center's adult program. So tell me about this new program.
This new program we're very proud of at the UConn Health Center. Previously, children with sickle cell anemia were cared for very well at the two very large pediatric centers in our state, Yale New Haven Hospital and Connecticut Children's Medical Center. And with the advances in sickle cell care over the last 30 years, children have been living into adulthood. And the excellent care they've been receiving in the children's hospital has been for naught because they could not find anywhere to be taken care of as adults. They found themselves in sort of a no man's land, unable to find physicians with expertise in sickle cell anemia care to care for them once they've reached adulthood. And therefore, they tended to use emergency rooms for routine care, particularly for the management of severe, painful episodes.
So what are they going to find at this facility?
At this facility, we have state-of-the-art care for people with sickle cell disease. We have transfusion support. We have same-day management for acute pain. We have chronic pain management for individuals living with sickle cell disease. We have counseling. We have a social worker and a dedicated nurse. Our patients who are seen for sickle cell disease at the UConn Health Center receive comprehensive care, which is also preventative in nature. And our goal is to improve upon what our pediatric colleagues have done in terms of improving childhood mortality and having our adults live long, productive, healthy lives.
Now, you kind of touched on it, but what is the need like here in Connecticut, for a facility like this here in the state?
There's a great need. We estimate, and it's just an estimate because we don't quite have our hands on the numbers of adults with sickle cell anemia because of their ED care, but we estimate a couple of thousand, 2,000 to 3,000 adults living with sickle cell disease, and only about 200 to 300 of them are in sickle cell centers. One adult center at the UConn Health Center and one at Yale New Haven Hospital.
Wonderful. Thank you so much for getting the information out there, getting the word out there about this new facility. I'm sure, as you just said, many people will be able to take advantage of it.
That's right.
Thanks for your time.
Thank you.